Hello everyone. Let's be honest. Do you fracture file while doing root canal treatment in your clinical practice? Then this video is for you. Even though we may be doing root canal treatment for quite so many years in our clinical practice, still there are chances that we might fracture a file once in a while. But is this file fracture happening frequently in your clinical practice? And whenever a file fracture happens, are we the one we blame, or we say that one among these three factors is responsible for the file fracture? We say that first, the tooth is quite calcified, thus blaming the tooth for the reason for the file fracture, and because of this calcification the file got bound and it got fractured. Or maybe the tooth is quite long, or it may have a narrow root canal system, that's why the file got separated or it got fractured. Or there may be an extreme root canal curvature, so this root canal curvature make the file to get separated. Yes, stop blaming the tooth for file fractures. The next reason or the factors that we say that the files that we are using are not good. They may have some manufacturer defects, or maybe this file system is not good, or maybe the files are quite old. That may be the reason. So that will be the second factor that we blame. And the third reason that we blame are the patients. We say that the patient closed the mouth while we are doing cleaning and shaping, or we may say that the patient tilted the head, or the patient is not cooperative, or the patient was having pain and suddenly there was a jerk leading to the file fracture. What do if I say that none of these are the prime reason for a file fracture, and we, the dentist, are the most common reason for file fracture while doing cleaning and shaping? Don't worry, I am going to teach two important factors, and if we understand these two factors, then we can prevent file fracture in most cases in our clinical practice. The first one is called as a flexural or a cyclic fatigue failure. So this is the first reason that a file get fractured. Don't worry, I am going to explain everything in a beginner way. Don't worry. And the second reason for a file fracture is called as a torsional fracture. These are the only two reasons for a file which gets fractured in the root canal system while doing cleaning and shaping. And I am going to explain in small pieces and in a easiest way that is possible for you all to understand, and how to prevent these file fractures in our clinical practice. By the way, I am Dr. Benin Palayan, and if you are interested in my videos, consider subscribing to my YouTube channel Smart Dentistry. I will make videos that will be useful for dentists and dental students. And if you are a beginner trying to start using rubber dam in your clinical practice, my course I recently uploaded in Udemy, Rubber Dam in Clinical Practice, will be really helpful. I will put a link in the description. Consider having a look in this course. Let's get into the fracture of the file prevention techniques. The first, we have to understand what is called as a flexural or a cyclic fatigue failure. I took a small piece of a plastic and I am bending it repeatedly. So this is what happens to the file inside the root canal system also. Not once or twice, that happens around 300 times in a minute. So just imagine you are taking a small piece of metal or anything, and if you are bending it repeatedly again and again, what will happen? So the file will start losing its properties and it will start to undergo flexural failure. Or as this is happening repeatedly, we call it as a cyclic fatigue fracture or cyclic fatigue failure. We can see this small piece of plastic has given up, and after some time of repeated flexion and extension, it got fractured. The same type of fracture will happen inside the root canal system also, which is called as a flexural failure. Let's see into a more clinical scenario. A file which is bent like this repeatedly will undergo fracture. Let's consider this clinical situation. We can see that the file is bent in the coronal portion, thus making the file constantly bending and extending in this portion. So the file is undergoing a constant flexion and extension. We cannot see the file moving from one direction to the other. Why? Because the file is engaged within the root canal system. So in this way, the file cannot move here and there. So where this flexion and extensions are happening, this is happening within the file. So the metallurgy of the file gets constantly replaced or repositions, or it undergoes a constant modification. So what happens? This is happening repeatedly. Maybe we can say that around 300 times in a minute, and this will lead for the file to get fractured. So now I think that you are having a better idea what is a flexural or a cyclic fatigue fracture of an endodontic file. Let's try to understand how are we going to prevent this type of fracture in our clinical practice. First, we have to have a proper wide access cavity preparation. People say that there is a modern molar access and there are conservative access, the ninja access, the truss access, and there are so many different types of access cavity preparations, and we still say that the files are very resistant to flexural failure, and so that we can make the access cavity very conservative and we can do cleaning and shaping. Yes, in some situations we can do, but for most situations, just look at this portion of the tooth. Just imagine if we are removing this part of the tooth while doing the access cavity preparation, the file will have a straight line access to the coronal one side. Don't worry about the apical portion of the file or the curvatures in these areas. Do not worry about it. I will explain why. So always worry about the files having curvatures in the coronal portion. In this portion, there should not be any curvatures. The file should always have a straight line access in this. Why? Let's try to understand. If you are taking any file, the file in the apical portion will be quite thin. It will be very flexible, which is very resistant to fracture by cyclic fatigue failure. But this portion of the file, which is close to the handle, which is quite stiff, and this portion of the file is very prone for cyclic fatigue failure or a flexural failure. So what we have to understand is, whenever there is an apical curvature, the flexible portion of the file is going to engage the apical portion and this will not fracture. But if there is a coronal curvature like an improper access cavity preparation, thus there is a bend in this stiffer portion of the file, then the file will break easily. So keep this point in your mind, and now hopefully you can understand that why the file get fractured in this area, because this is a stiffer portion of the file which is not flexible. So there are more chances. So whenever you fracture a file and you see that almost the entire length of the file got fractured, so this is the reason that it has undergone a flexural failure. So an easy way to overcome this is, whenever you are using a stiffer file, for example, in a ProTaper system, if you are using F3, F4, F5, or maybe you are using a 36% taper file in any other system. So in those situations, we can reduce the speed a little so that the chances that the flexion and extension happening in the coronal portion will be very much reduced. So again, we have to follow the manufacturer instructions. But for example, we can reduce the speed by 50 rotations per minute. Maybe we can set it as 250 instead of 300 or 350. We can prevent most fractures of these stiffer files. Again, keep it in mind, this flexural failure is more common in the coronal portion. So if your file get fractured in the coronal portion in these areas, we can always think that it is a flexural failure or a cyclic fatigue failure. Always keep it in mind. You would have seen so many social media posts in Facebook and Instagram and all those things. Whenever a file gets fractured by a flexural failure, it is very easy to remove. Okay, so next the modification or the next tip that I will be giving to prevent a flexural failure of a file is the angulation. So the angulation, we are holding the endomotor while doing cleaning and shaping. The angulation should should allow us should allow the file to enter inside the root canal system in a straight line. So it is a common practice for a beginner that holding the file or holding the endomotor in a different angulation, thinking that it will enlarge this portion and it will create a straight line access. No, do not do that. The file should go inside the canal passively and it should have a straight line access. So whenever you are holding the endomotor and if you are doing cleaning and shaping, if you find some vibrations in the handpiece, then always consider that the angulation is not straight. If you are holding at a straight angulation, there will be no vibration in the handpiece. Keep this in your mind. So if there is a vibration or some the file is trying to move your hand or the endomotor get vibrated, stop, and you are not holding it along the straight line which is needed for the file. So the next we can use a control memory file. Most of the file which comes in a golden color or a blue color, they are all control memory files. If you are bending those files, it stay bent, or we can say it is also heat treated file. So this heat treated files have a very good cyclic fatigue resistance, so it will not break easily compared to the conventional austenitic files. For example, the ProTaper Universal, the K3 file system, the Hero Shaper, all these things are the older generation files are all austenitic files which stay straight, so they have a poor cyclic fatigue resistance, so they will fracture easily. And if you are a beginner, I would say that if you are looking for the ways to prevent file fracture, then you can go for these control memory files. And if you are looking for an instrument which cuts aggressively, we can go for the older systems like a ProTaper Universal, but it takes a little experience to prevent fracture with this austenitic files or the conventional files. So if you are a beginner and if you are fracturing so many files, then you can go for this gold or the blue color files which have a more resistance to cyclic fatigue failure. The next important reason is holding the file stationary inside the canal. So this again, the beginners will always think that if you go inside the root canal and they will hold it in a stationary position, but I always say that, so never hold a root canal file stationary inside the root canal system. Just go inside and come out immediately. Just go, come out immediately. So if you are doing this, it will not bind the canal, or it will not undergo this flexion and extension at a constant position. So in short, do not hold the file stationary inside the canal. Always keep moving the file up and down. So that's are the some of the easy way that we can prevent the file by a flexural failure. Okay, so by preparing an access cavity which is proper and holding the file and holding or keep on moving the file in an up and down motion while doing cleaning and shaping. So now let's move on to the second portion, which is called as a the different type, which is called as a torsional failure of the file. So let's see this example. This is a small piece of paper. I am holding it in one end and I am trying to twist the paper at the other end. The same thing will happen inside the root canal system. So once the file goes inside, it may get stuck in the apical portion, but the file keeps rotating. So the file keeps rotating, and the file will get fractured. So now you are getting, so this is a torsional fracture, or this is a torsional failure. So you can see the piece of paper have got fractured. In the same way, the file will also get fractured. So this is called as a torsional failure. Let's transpose this into a clinical scenario. So what happens is, if we are doing cleaning and shaping, this is something like this happens. The file goes inside and the apical portion of the file gets engaged inside the root canal system and the coronal portion keeps moving. Let's see in another example. So we are doing cleaning and shaping, everything is fine, but just imagine the apical portion is quite narrow and the file in the apical portion gets stuck. It is not moving, but look at the coronal area. here, because of the endomotor and the force, the file keeps moving. The file is keep on rotating. So what happens? The apical portion got stuck over there and the coronal portion is moving, and what happens is the file gets threaded inside and it is so much engaged tightly, so the file cannot move in the apical portion, leading to a file fracture. So this file got fractured because the apical portion got threaded inside the root canal, but the coronal portion kept rotating, but the apical portion couldn't move, and so it got fractured. So this type of fracture is called a torsional fracture or a torsional failure. And whenever fracture happens because of this torsional failure, then it is very difficult to remove, or in most cases it is impossible to remove with any of the modern techniques. So let's understand how to prevent this type of fracture from happening. So the first is avoid pushing the file forcefully. So it is a common practice that people will try to push the file more apically even if it is not going. So what will happen if the file is not going easily? If you are pushing, the apical portion will go somehow like a screw, it will get engaged. So once it gets engaged, the coronal portion, and we are setting, let's keep that, we have set the torque in the endomotor to a higher level, and so endomotor applies so much force, and so the file will get stuck and it will fracture. So what's the way? So do not push the file forcefully inside the root canal. It should go gently, it should go inside and it has to come out. The next is, we have to always create a proper glide path. People are often recommending that there is no need for using a hand file. We can use a rotary file directly. So I would always say that there are many advancements which are happening. So there are the glide files, the pathfinder files. But if you are looking into the manufacturer instructions of all these glide path files, it says that first we have to create a file pathway, that is a glide path with a 10 or 15 size file, then only we have to use all those. So the hand files should be used, and the hand files are inevitable. So do not attempt to use a rotary file without using a hand file and without creating a glide path with hand files. So with a good glide path with a hand file, the rotary files will never ever fracture. Listen again. So the rotary files will not fracture if there is a good glide path and if you are not forcing the file. So always create a good glide path. And always remember that the torque setting for a stiffer files, we can set a more torque, maybe 3.54, we can set it, not at all a problem. But for a flexible file, maybe for example in Pro taper system, maybe the S1 file, maybe in the in the taper based systems, maybe a 4% file, a 2% file, or maybe which is having a lesser taper, or a thin flexible files, maybe a 24% file, a 17.4% file. In those situations, we can set the torque to less, maybe 2, maybe 2.5. We can set it as a lower torque. So this way the file will not get screwed inside the root canal system. Also we can use a file which is having a alternative tapers, or maybe a progressive taper like a Pro taper. So in this way also the screw-in effect will be reduced. So always for a stiffer file or more rigid file, we can set more torque, because these stiffer files are more resistant to torsional failure. The stiffer files undergo failure by flexion, and the flexible files undergo fracture easily by torsional. Keep it in mind. Okay, so whatever the files may be, so we can choose the files and we can set the speed and torque. So now we can understand, for a stiffer file we can set a more torque but less speed, but for a flexible file we can set more speed and a lesser torque. Now we can understand that a flexible file will undergo torsional failure and a stiffer file will undergo flexural failure. Okay, so and again next we can avoid the aggressive cutting instruments. For example, there are many instruments which have a partially active tip. So this instrument will cut, and even if there is a calcified portion or a narrow portion of the root canal system, it will get engaged and it will forcefully bind and it will get fractured. So we can avoid this aggressive cutting instruments. And the next important step or a factor that most people avoid or they will not understand is that there should be a frequent irrigation, and we have to clean the file of debris frequently. If there is a debris which is sticking on the file, then there are more chances that the file will fracture easily. And if you are working in a dry environment, if the root canal is quite dry, then the debris cannot be cleaned and the file will undergo a torsional failure or it will undergo torsional fracture. So hopefully if you can keep these rules in your mind and if you can practice the simple guidelines, then there will be no cheating or there will be no shortcuts, there will be no easy way. But if you are understanding these easy ways or the straightforward ways, then we can prevent file fracture in most of our clinical situations. So I hope that this presentation is useful for you. So always keep it in mind that you have to understand the type of the file, whether it is a flexible file or a rigid file, or what speed and torque we are setting. It is not a constant setting for each and every file, and also realize that most of the fractures can be prevented if you are understanding this concept and keeping this concept in your mind while you are doing cleaning and shaping. Thank you for watching till the end, and I will come up with a new video. Thank you. Stay tuned. Have a nice day.